Urine toxicology is actually a big business in medicine across many fields, not just pain management. A lot of healthcare facilities, critical care units, emergency departments utilize tox screening as well. As of 2015, it was close to a $5 billion business. A lot of new companies out there that are offering tox screening services across multiple states, and some of those companies have gotten into trouble in terms of having contracts with physicians that were kind of maybe doing more tox screening than was probably medically necessary. There's a lot of different definitions in the tox screening world. One of the newer ones is presumptive versus definitive urine drug screen testing. Presumptive testing is testing that can be done kind of on the spot, also known as point of care testing, whereas definitive testing usually gets sent out to a lab to specifically quantify what drugs are in a patient's urine. Presumptive testing just kind of gives us feedback on what drug classes are in the patient's system, things like morphine metabolites, oxycodone, fentanyl, without actually telling you what metabolite is in the screen. So that's usually when definitive testing is done to tell you what exactly is in the urine sample. So there's multiple guidelines out there. American Society of Interventional Pain Physicians has guidelines, American Society of Anesthesiologists, the VA, some states have guidelines. The basic thing for family doctors to take home about urine tox screening practice is you want to show what's medically necessary for the patient. The patient's a high-risk patient, and you want to have that seen in your electronic medical record. So when you do high-risk tox screening or definitive studies, you're reimbursed for those studies. There's a lot of different trends going on for tox screening right now. In the state I practice in, Horizon, Blue Cross Blue Shield's the main healthcare company I deal with. And what they're doing now is they're not really paying for tox screening until they see the medical necessity outlined in my electronic medical record before they pay me for the screening we do on our patients. Concluding thought regarding tox screening is to document, document, document. If you're seeing someone who you think's at high risk for aberrant behavior, document in your note, so that way the company knows when you send the screen out for definitive studies, why you're sending it out for definitive studies and what you're interested in looking at in that sample.